Hey y'all, hey, it is Dr. Cherry. I am here with Chapter 7, Understanding and Treating Substance Use Disorders with Clients in Crisis. This is coming from the Jackson Cherry and Erford third edition of the Crisis Assessment, Intervention, and Prevention textbook. So for starters, let's look at some of the statistics when we look at understanding and treating substance use disorders with clients in crisis. So for starters, the Substance Abuse and Mental Health Service Administration, also known as SAMHSA, S-A-M-H-S-A. The stats that they came up with are 52% of Americans, 12 and older, are currently consumers of alcohol. 25% of Americans aged 12 and older are currently users of tobacco products. They also show that approximately 25 million Americans reported some form of use of illicit drugs, and that was in 2013. That number is probably not going to be extremely accurate because most people are not going to actually admit to using illicit drugs. And so this classification of drugs is really important. These are classifications from the FDA, the U.S. Food and Drug Administration. These drug classifications are cannabinoids, depressants, stimulants, and then you have hallucinogens, then you have nicotine, you have opioids, and psychotherapeutics. You also have a designer drug known as ecstasy. The Comprehensive Drug Abuse Prevention and Control Act of 1970, they controlled drugs into these schedule classifications. So you have like Schedule 1 drugs all the way up to Schedule 5 drugs. So Schedule 1 drugs have the highest potential of abuse and dependency, whereas Schedule 5 has the lowest potential for abuse and dependency. And these are things like, cough syrup and codeine and things like that. We also understand that if you're dealing with a crisis situation, those that have pre-existing conditions, you'll have a higher ability to start abusing substances because of your pre-existing condition. So if there's already someone who's dealing with chronic pain, and then they're taking pain pills, it's an easy road to go from managing pain to actually abusing pain pills. But you do want to understand there is a strong correlation between substance abuse and substance use and suicide and even homicide. There is a high usage or high correlation between alcohol use, violence, substance abuse, and things like homicide and suicide. So these two are very close cousins. If someone is abusing drugs, often they'll be more likely to commit a violent act or something like that because they're actually under the influence. And so even sexual violence, it talks about that. If you're under the influence and you do something, although it's not a legal defense, it's a reality, that with the use of substance abuse and, substance use, then you can tend to do certain things in society that you normally would not have done had you been in a different frame of mind. All right, so let's look at some of the genetic and biological models that we have as counselors as we're helping individuals who are facing a crisis and who may be dealing with substance abuse and substance misuse. And so one of the first ones is the social learning theory. So this one came from Bandura back from 1977, although there's a lot of current data about the social learning theory. And according to the textbook, it asserts that people learn from one another through observation, imitating, and modeling behaviors. So in the social learning theory, if all your friends in this theory, if all the person's friends are doing cocaine, it's easy to jump into that boat because you're just doing it because you're, trying to fit in, or you're, going with the flow. If everybody's drinking, it's easy for you to take a drink because you're going with the flow. Social learning theory is that we tend to mimic our environment. The social learning theory is that, we learn and we do through observation and imitation, and we model behaviors. And then number 2 is the cognitive model. And so this model, it looks at the basic tenets of cognitive learning. How are we thinking? And how do you bring your thoughts into action? So Whatever a person believes about a substance will influence the expectations related to the use. So if I believe a substance is just going to calm me down, like marijuana, then it's easy for me to use it if I just believe it's just going to calm me down. If I believe a substance is going to give me more energy, but I won't be addicted, then it'll be easy for me to use that substance because I feel like I'm just getting more energy and I need energy for this event. So it's how you think about something. And so number 3 is the conditioning model. And the conditioning is part of a classic concept of classical and operant conditioning. So it looks at the substance abuse as a problem, but as a learned habit, right? It's a response to a specific behavior. So I take pain pills because I'm in pain. But when I'm no longer in pain, I'm used to taking these pain pills. It's a learned behavior. I'm going to continue doing this because my body feels better when I take it versus when I don't. It's a learned behavior. Number 4 is the sociocultural perspective. And this one is really key because as a therapist, you're going to need to take time with your client and look at their cultural background. And so the sociocultural perspective, it looks at things as acceptable and if the substance is available. And so if the society is consuming it, if this is a cool thing to do, then in my culture, it's okay. And so the sociocultural models, what does it look like? Is it acceptable in that particular culture? And then the last one is the psychological model. And so the textbook has a psychological model and also the psychodynamic model. And it looks at substance abuse as originating with the problem in childhood development. So the psychological or the psychodynamic, it looks at when did the attachment disorder start, or when did the ego deficiency start? And individuals who use substances may do so because of the problems with affect and regulation, or problems, connecting with adults. And so it's usually something that happened way in the childhood that you're trying to suppress or you're trying to come to terms with, and it affects you growing up. Okay. So when you're looking at your clients and you're looking at their substance abuse and their substance misuse, you want to look at screening and risk factors. And so this is where you have to do the work. Part of the factors, are you looking at, you want to look at the AOD availability, the alcohol and other drugs, the AOD availability, what's available to them? What kind of peer pressure do they live in? What is their academic record like? What kind of adolescence issues have they faced or are they facing? Are there any learning disabilities? And these are some of the factors you want to look at and you want to take into account when you're looking at their substance use disorder. You can get a lot of your answers from your screening protocols. And so the first step in the evaluation process is to rule out alcohol and other drug problems. What other things do they have? So it's going to be kind of challenging if you're dealing with someone who has chronic back issues and they're taking a pain pill because they need it, versus someone who had surgery 15 years ago and they're still on the pain medication, right? And so you want to look at, you actually want to address it and look at, if their body is now addicted to it. And so in your screening process, you are kind of weeding out any other problems. And so your screening should be really brief. It should be really brief and to the point. And so from your screening, you then move to assessment. And so you can do assessment by using a lot of the standard tests that are out there. There are a lot of assessment instruments that are out there. But before you start any assessment, you have to be mindful that your client must sign an informed consent. And the informed consent simply tells the client what this assessment is for, what is it intended to measure, if there will be any risks involved. And so the client is fully aware of this assessment tool that they're about to become a part of. But the 4 main ones that you need to be aware of is the audit, AUDIT, the audit, which is the alcohol use disorders identification test. That one, as well as the MAST, which is MAST, That's the Michigan Alcoholism Screening Test. And then you have the Substance Abuse Subtle Screening Inventory 3, or other known as SASSI 3. And SASSI is SASSI 3, SASSI 3. And then you have the CAGE, and that's CAGE. And the CAGE is a 4-question screening tool that you can incorporate as part of your clinical interview. And when you're going through your assessment, you want to have 5 main purposes. The first one is to ascertain the degree and severity of the problem. Number 2, to determine the presence of co-occurring disorders. Number 3, you want to make an accurate diagnosis. You have to have a good assessment in order to have an accurate diagnosis. Number 4, to assess the scope of the problem. Is it a systemic problem? Is it an individual problem? A family problem? What's really going on? And then number 5, to guide the treatment planning process. And then 6, to provide a mechanism for communication. So then you have your DSM diagnosis. You're going through your assessment and you get to the DSM diagnosis, but you want to make an accurate diagnosis. The American Society of Addiction Medicine, ASAM, they put together like a chart to let you know where the person is on the substance use disorder and the co-occurring line. And so you have different levels. You got a level 0.5, which is early intervention. You have level 1, which is outpatient services. You have level 2, which is intensive outpatient or partial hospitalization. Most people call that PHP. Level 3 is residential inpatient services. And then you have level 4, which is medically managed intensive inpatient service. And so you want to figure out what level are they at, and if they need to be hospitalized, if they need to just, have a couple of outpatient sessions. But you really want to look at their multicultural perspectives. You need to understand how they view the drug, and you can't just give them what you think is right. But you want to look at how they view the substance. Remember, we talked about that cognitive piece, how they view it, how they understand it, what their goal in using it is doing. You want to look at all these things and make sure that you're just mindful. You want to make sure that you're just really, really mindful of your client and your client's position, and not just fully imposing who you are. And because keep in mind, the counseling session should be a joint effort, a joint process where you both can make sure that the client is on the best path that they're ready for.